We are live. I'd like to welcome everyone to another episode of Heart to Heart with Bree. And tonight's topic is when menopause and mental health collide. And it is some kind of collision. I will say that. I'd like to welcome my guest, Juliet Nelson. Juliet, would you please introduce yourself to the viewers?
Yes, good evening, Bree, and good evening, viewers. I hope that there's a lot of folks listening right now, and even if you're not, hopefully when you come back to this podcast, Bree, thank you so much for having me. I'm just so excited
Anytime.
to be here to be able to share into this conversation about menopause and mental health. So my name is Juliet Nelson. I am a mental health nurse practitioner. I pride myself on being a nurse for many years, and my love for behavioral health, behavioral medicine, or psychiatry has spanned for many years. So I'm happy to be here, Bree, to talk about, again, menopause and mental health, which is, something that I truly enjoy talking about. So,
Thank you
thank
so much. As I mentioned to you the other day, I covered this topic a few months ago, but I'm so happy that you're here to touch on the mental health aspect of it. And it's something that a lot of women go through, and I'm hoping that the men will tune in tonight because I think this is information that can be beneficial to the men too. So please don't look at this topic and think, not for me. Nah, you need to tune in. So I'll jump right into it, Juliet. How does menopause affect a woman's mental health?
Okay, good question, Bree. Thanks for asking that. I always like to start with a couple things because menopause, talking about menopause, it would take forever because it is
Yes.
still that topic that has so many different arms to it. But just for the purposes of tonight, I just want to share some information about menopause a little bit and more so how it relates to our day to day or mental health. Um, just a little bit of general understanding. Menopause, again, is it can affect a woman's mental health because in a way because it actually does collide with what we call the hormonal cascade. Okay, so for us women, we find that when we're going through this phase of life, right, we all have neurochemicals in our brain, and then when we're going to at this stage, we now have the hormonal considerations. So how do we kind of tether what's happening neurochemically and hormonally? And this is where the collision occurs. Now, when a woman is going through this transition in life, we have changes or fluctuations in some of these hormones, estrogen and progesterone, right? Some of these amazing hormones that guide our reproductive system. And then again, the brain, and when there is a mental issue going on, right, which can be brought on by stressors and so on, we find that this is the time of life when so many changes happen. And women just do not know what's going on, especially,
Yes,
right?
yes.
Not that this couldn't affect men too, but women do, experience some very difficult emotions, or they experience some difficult changes in their life that they just don't know what it is. And so we find that this is now a point where we have to talk about it. We have to figure this out. We're going to have to learn as much as we can about it because this has the potential to disrupt our lives in many, many ways. So this is where we are now for such a time as this, where again, as a mental health nurse practitioner, I see women and I talk about so many of these unanswered things. Like, what is that? And some women just don't even know what's happening. So we're all looking for
It's
answers.
true. Juliet, when I was in perimenopause, to be honest with you, I didn't know what was going on. I'd like to welcome my friend Joyce Lammy. Thank you so much for tuning in.
Okay,
I
welcome.
was, for months, I kept it to myself because dementia is something that runs in my family. And I started to have problems. I didn't know what brain fog was. I had no clue. But all of a sudden, I noticed my memory wasn't very sharp. And I was going through hot flashes, which I thought I was too young to be going through hot flashes. So I didn't think this had anything to do with menopause or perimenopause or anything like that. But I can tell you that I thought I was in the early stages of dementia. And I was afraid to talk about it because, it's like I didn't want to be labeled, but I was afraid. I was in fear for a long time until I read something about estrogen, and it listed all the symptoms that I was going through at the time. And I remember crying because I was so relieved to realize that I was not like having early onset dementia or anything like that. But I was, what was upsetting about it was, why don't women talk about this? Why are we not prepared for this until it starts? And because a lot of women are clueless. I mean, what's your take on that? Do you find that a lot of women, as you mentioned earlier, I mean, there are some women who honestly don't know what's happening to them?
Yes, yes, true, Brie. And more, when I talk with women, I know a lot of women, when we tend to talk about menopause a lot more easier than talking about mental health issues, right? So
Yes.
when I talk to a lot of women, you're like, oh, I think I'm going through menopause, right? And it's probably easier conversation to have because we expect that it's a natural phase of life, it's a transition, right? But let us not forget too that there are sometimes underlying mental illness, and
Yes.
it is sometimes a very thin line. You do this, all these screenings, and you're having a conversation, and you recognize that, despite the blood work, despite all the screenings that I've just done, everything comes back pretty normal, and it might not be menopause, it might not be perimenopause, but it could be an underlying mental illness or a mental health issue. So I find that this is a kind of a balancing act, because many women do not know what's going on, but yet
Yes.
when we kind of uncover a couple of things, we realize it's really perhaps not fully all menopause, it's fully not hormonal. It could be
Right.
a mixture of both too. So, yes, a lot of us do not know what's going on, but I believe that it's important to talk about it and
Yes.
be very open about what you're feeling, and come to the table being honest. Again, we're
Yes.
talking about menopause, but we're really talking about mental health conditions,
Mental health. Yes.
right? Because
Definitely.
sometimes they kind of layer on each other. But
It's
again,
true.
just being very open to talk about it is important. The signs of menopause, some things that we notice that happens look a lot like mental health issues. And there are some mental health issues that could be menopause or hormonally related. So when we're kind of in limbo, I always say, and I keep going back to it, do not be afraid to just talk to somebody about it. Talk to a clinical person too, because we also go to the internet and we go look for the information that we want to see and hear. Because
Yes.
sometimes we just don't want to face some of the things that we need to. But it's the time.
Yes. Yes. I'm so glad you said that. I'd like to welcome my cousin Lennon Lashley. Thank you so much for tuning in. So the next question is, what are the most common mental health symptoms women experience during perimenopause and menopause?
A lot of these symptoms are their mood conditions. You just kind of feel a certain way. For some women, and again, there is no one symptom that looks the same for everyone, right? There are some folks who are just so irritable. You find that all of a sudden, you're just this calm, nice, sweet person. You're not, you know, you weren't irritable before. And then all of a sudden, you recognize that you have this degree of irritability
Yes.
towards others, even the folks in your life that you truly love, and you don't want to be mad or irritable at them. You have things like sleep disturbances. There is anxiety. There is depression. There is just all kinds of things. You're tired. Quite a bit of fatigue is present in
Yes.
both, again, menopause and perimenopause and mental health issues, right? But depression, anxiety, irritability, fatigue, mood changes. You're 1 minute you're this, and then next minute you're just, you know, the other side. Not to mention, sleep issues. A lot of folks cannot sleep with whether it's menopause, whatever it is. But the whole sleep issue also tends to be a problem. Again, with women going through menopause, it's you cannot sleep because of the hot flashes and things like that. But there is quite a bit of overlap. But we see a lot of these symptoms when someone's going through um, the different stages of menopause.
I can tell you that insomnia was probably the worst part of it for me. Not being able to sleep, you don't realize how precious sleep is until you can't sleep.
Yes, yes, exactly. And not just that too, but when you're not able to sleep, you have this. I tend to say it's that this increased sensitivity.
Yes.
What you call
Yes.
it's like someone says something to you, and you're like, and this emotional reactivity. It's almost like you're always on edge.
Yes.
So with sleep, you without sleep, of course, the body just doesn't do well. The body's always just hanging a tether in there in the middle of, and God forbid if somebody says something to you, you know you're just blowing your top. So again, some of these things that we screen for, we look at these conditions like anxiety, depression, and so on and so forth. But I want you to know that sleep is usually the number one thing that bothers most women.
Yes. Yes, it's hard, especially when it's bedtime, you're tired, you want to sleep, but
Mm-hmm.
when you put your head on the pillow that you won't sleep.
Yes,
You'll
and there.
toss and turn all night. That in itself, I think, will make you more depressed. And the more you go without sleep, I mean, when I think back to that stage, I was not a very pleasant person to be around, but it's hard to explain, but I felt like a monster.
Mm-hmm.
But it's like I just wanted to scream sometimes because it's bad enough to go through the hot flashes and all of that. You're hot, you're cold, you're hot, you're cold.
Yes.
But then you so desperately just want to sleep. You
Yeah.
just
Yeah.
want to sleep. It's definitely hard.
Yes, and not being able to sleep too has its own part of anxiety. We call that nocturnal anxiety. You're
Okay.
on the pillow, you're laying there, and then all these thoughts just come up. They're just racing and ruminating. You're all over the place. There's no settled space, right? And then it throws out all of your other body systems. So
Yes.
again, so important that this is discussed with your, medical provider. And just before I go any further, I'm here to say too, this podcast is just for information purposes only. I'm not here to assess, treat, or diagnose, right? It's just to share information, and folks
And
need to.
great information because I do believe knowledge is power.
Hmm.
And I believe it would have been a smoother transition for me when I was going through this if I would have had the knowledge at the time, because I found this whole process to be very irritable. But if I'm to be honest, it was scary because I wanted to feel normal again, if that makes sense. I don't know if women say that to you, but I just wanted things to go back to the way they used to be before I was sweaty all the time, before
Hmm.
I couldn't sleep, before I was so irritable. And I just wanted to feel like my old self.
Yeah, yeah, of course. Can be very uncomfortable, very, very uncomfortable.
Yes. I'll move on to my next question. Can you explain the connection between hormonal changes and mood disorders like anxiety or depression during menopause?
Yeah, well, so I often say we must take a look at clinically, like how do I kind of make a determination as to what's what? Because hormonal changes are it's transient. It's almost like you expect that things will change once some things are addressed, right? And we know that there are many approaches to managing the menopausal symptoms. We use, medication. We ask, as a holistic practitioner, I'm always encouraging women to practice lifestyle changes, go to bed on time, changing the diet, exercise, those kind of things, right? And we usually again do the blood work. We want to check for these hormone panels. We see what the results are, and we make recommendations, right? Um, so clinically, this is how we address. We know that you're in menopause, right? You've not had your monthly flow for a while. So there are measures, right? We
Okay.
know exactly what that means. If this is what menopause is for you, is it perimenopause, or are you postmenopausal, or are you in active menopause? So we have these measures. Now, when it comes to other clinical issues like anxiety and depression, right? Mood disorders, whatever is going on, right? We have things called bipolar disorder, all kinds of other conditions that are unique to each individual. We have different ways of quantifying and qualifying those things too. We use a lot of screening tools in psychiatry. We ask questions, a good history and physical. We ask about appetite. We ask about sleep. We ask about feeling, a sense of hope and worthiness, those kind of things, right? And based on these responses, we start to understand more about whether is this a hormonal issue or is this a neurochemical issue as it relates to the conditions we're looking for. So, for example, depression. We know that with depression, we ask you about over the past 2 weeks, what has happened in your life. Are you getting up every day? You're taking a shower, you're taking a bath, like, those kind of things, self care stuff. Because, when you're experiencing depression, it just looks different from a hormonal issue. So, as a mental health nurse practitioner, I'm able to assess, treat, and diagnose these kind of conditions based on a good history taken and open and honest conversation. Because many times we just mask, you know, the real issue. We don't want to tell anybody how we truly feel, thinking you're alone. You're not alone. None
Right.
of us are that, crazy unique where we do not experience many of the common things that come with these two phases of life. So,
Would
this is how we
now
differ.
do you think it's a good idea, like coming to see someone like yourself, if a woman decides to bring her spouse so that he can have a better understanding of what she's experiencing?
Yes, I believe that, there's so many committed spouses who show up with a genuine interest to help their partners. And sometimes when you self report, you could perhaps also miss out on some of the critical information that I need to know and understand. And you're not able to share that, what we call subjective information. How are you really feeling? And there are others who are on the sideline or observers who will say, look, I noticed that, you know, so and so. You may not have remembered that you didn't take a shower over the past 2 days, but someone else might. So we do ask that you bring someone who is supportive of what's happening, without shame, without judgment, and bring them to the visit. Come on the video. Bring your whole family and take with you who you would like to take to that interview, just so that you can all have both subjective and objective information, so we can make the most accurate decision to come to the most accurate finding too. Because you never want to be diagnosed with something that you don't have because you did not report accurate information. But no one wants to be taking any, prescribed medication or any kind of drug therapy for stuff that doesn't warrant that, you know. But it's because you reported some stuff why you're even being treated that way. So, yeah, bringing someone to the visit is important if there is such a person.
And you mentioned, I'm glad you brought up the word shame. You know, I can say personally, because I was not sure what was happening and thought I was like having, going through dementia, and you know, I could see how this whole process changed me because of the lack of sleep. And as
Mm-hmm.
she said, my cousin Lennon says, lack of sleep and anxiety. That feeling of anxiety because I don't know what the heck is going on,
Mm-hmm.
and questioning, after a while, questioning my sanity, because the more you go without sleep, I do believe you start to feel insane, you know? So it's like, what would you say to the woman out there that's struggling because she's embarrassed? Then when you start to go through these changes, like I can say for me, I can't speak for every woman, but losing confidence, because it's like to me, it's you feel self-conscious when you
Yeah.
become this sweaty individual. I remember, like, I stopped wearing makeup because it was like it would just sweat right off.
Yeah.
So I was very self-conscious because I don't want to I felt gross. That's the best way I could describe it. I just
Yeah.
didn't feel fresh anymore, So I'm asking to, like, what would you say to the woman that is struggling? Because I wish I'd come to someone like yourself. I think I would have saved myself a lot of heartache. So what would you say to that woman who's on the fence about coming to see a professional like yourself?
Yeah. Well, there is no point of kind of internalizing a lot of what we're going through if it is just not normal. It doesn't feel like real for us, right?
Yes.
And the more you kind of internalize and become preoccupied with those symptoms, we call some of these symptoms vasomotor symptoms, like the hot flash and all the feelings that you have, the physical feelings in your body that no one can kind of see. Only you like feel that stuff. Or what we call the somatic symptoms. It's the stuff that just are so uncomfortable. Start somewhere. Tell someone, right? I tend to say, look, if you have a primary care physician, start there. Like, tell your doctor, make an appointment and tell your doctor. Because there's still a lot of folks who are a little bit, they just don't want to talk to psychiatrists. You know what I mean? Like, they're like, and even if your primary doctor says, look, I think you want to talk to someone in psychiatry, like, they're just literally like, no, right? So I say start with a primary care physician, because what they do, right, they have the ability and the expertise and the training to really have the conversation about what is the next step, right? They put
Yes.
it in there. Um, but we must understand that we are not alone, because remember, menopause is a natural progression, right? It's a natural thing. It just happens. And but when there is an underlying issue with anxiety, it's going to become bigger. When you start
Yes.
feeling the hot flash, then you have the anxiety, then it just like compounds the problem. So I tend to say, is it bothersome enough that you should, like, how are you managing holding on to it? Because if you're managing okay holding on to that stuff without the help, maybe you kind of may want to continue to self manage. I'm being very honest, because resistance to kind of just getting help at some point, it kind of comes back to kind of, it's bothersome after a while, and you just never want to get there. So start with your primary care physician, talk to someone, and then take it from there. But as a mental health nurse practitioner, I'm also referring to, if you were to consult with me and talk with me, I'm able to talk to the OBGYN, for example. I collaborate with a whole medical team, an endocrinologist. I talk with OBGYNs. I work with amazing folks who have looked at this. Now, menopause has just come to the forefront recently, honestly, because my friend who's an OBGYN told me that in med school, there was not much time spent on that stuff. So we're all learning together. It is important that if you're feeling the symptoms that you're unfortunately, they're not normal for you, reach out and talk to someone. Do not go to bed at night not being able to sleep. Recognize that fatigue is not something that is normal. Ongoing fatigue is not normal. Anxiety is not something, anxiety is a natural state, but we do not expect that anxiety is going to be living close to you day in, day out. That causes a significant change in your life. You can't function. You need to talk to somebody. So start somewhere, please.
As I'm listening to you, I wish that I had seen someone like yourself, because I think I would have saved myself a lot of stress, because it was, such a stressful time. And the women that I've spoken to over the years, honestly, Juliet, I didn't know that I could see someone like yourself to work it out. I honestly thought that you just suffered through it.
No, you're not alone, Bree. I talk to a lot of folks, and let me tell you, there are some real cultural issues too with this whole thing.
Yes.
Okay, because I know there's a lot of misinformation about this happening and that happening. And listen, I've heard women come and tell me that this is voodoo and obia.
Wow.
Okay, all right, because and again, this was not discussed. Moms do not tell their daughters.
Right.
They say, "Oh, got you stuff," and you just sweat, and you see them running, fanning, and all that stuff going on. You talk about you feeling embarrassed and sweaty and feeling mucky, right? I still see women bursting out in sweat,
Yeah.
right? Because again, culturally, in some cultures, this thing is very much openly talked about, and in some cultures, no. But then we also recognize too that these hormonal issues, when we look back in our history, cultural stuff here, a lot of folks, there was quite a bit of mental health issues stemming
Yes.
from the same untreated hormonal problem, and it became something else. Or there was some other mental health issue, and then the hormone stuff happened during menopause, and it became worse, right?
Yes.
So, not to mention the postpartum issues when you have the kids and so on, right? So, I want to tell you, there's always a collision between hormones and neurochemicals in the brain, and unless it is treated, it has the potential to get worse, right? So
Yes.
that is why we must now work on decreasing the stigma, both the stigma of relating to menopause, because I know there are some women who look at this menopause thing as, like it's the end.
Yeah,
No, it's
that's how I honestly, to Juliet, I thought I was done. Like, this is it for me
yeah.
because I just didn't feel the way I used to feel. And it's like,
Mhm.
well, I have to accept to learn. I have to accept living like this. And I would like to bring this up. I know that for some women during that time, the last thing they want to think about is, intimacy. The last thing they want is sex. It's like, look, I'm already hot. I don't need a hot body. I
Yeah.
mean, you get where I'm coming
Yes,
from.
of course, of
That's
course.
why I think it's important for men to make these visits with their wives to really have an understanding of what the woman is going through during this time, because I think there are men who take it personally, like,
Mhm.
my wife is no longer interested in me, and it's like she's going through her own thing. She's going through, like, first of all, if she's able to go to sleep, I think a lot of women would choose sleep, especially when you're sleep deprived. You'd rather have some sleep than sex. I mean, I'm just being real,
Mhm.
during that time. And I think a lot of women struggle with, like, what they're going through. It's like it's overwhelming, but then having to deal with a spouse sometimes who may not be understanding, it just
Mhm.
feels like one more strike. I mean, you get what I'm saying. It's
Yes.
like after a while, it's like, where do I turn? What do I do? So I would encourage the women out there to see someone like Juliet because, like I said, I wish I would have had this option.
Yes. Thank you so much, Brie. And yeah, you're right. So many changes happen in the woman's body when estrogen, for example, right, fluctuates.
Yes.
And we must consider some options now because I'm not sure if you know the statistics about women and heart disease, right? And studies are out there very clear that lower levels of estrogen leads to quite a bit of heart arrhythmias. In other words, we see heart disease very prevalent in women, yet we were trying to understand why is it that heart attacks were like the number one killer of women and not breast cancer, right? We recognize that there is when hormonal fluctuations occur, many of our organs do not work as well, including the reproductive system, where you have the vaginal dryness, you have skin problems, right? Your skin gets dry. So many things run, depend on estrogen, right?
Yes.
So when we notice that there are many changes in our bodies during this period of time, this is also the time when women must take care of their oral health, for example, right?
Yes.
In gums, right? We Our skin, for example, we have to practice good skin care because everything dries out.
Yes.
Everything dries out. So talk about intimacy. It is also one of a very difficult time. Women end up with UTIs. They end up with quite a bit of vaginal issues, right? And it's uncomfortable. So I mean, I think we as women deserve better. Like we deserve to really take
Yes.
care of ourselves and recognize that we're not like alone. We all experience this at varying degrees, and now there are many interventions to manage that, especially for hot flashes, for example, right? You're on camera and all of a sudden you're dripping in sweat. I mean, it's not very attractive for partners. I mean, there was someone who told me recently in a conversation with he and his wife, they're both there, said he does not find it attractive. I mean, their hair is like always flopping on her face. It's just, he described it very graphically, and she was a little embarrassed about it, but um, he was very kind, but he was very open to say these are some of the things he notices, and she was also equally very uncomfortable with that kind of stuff. So I was able to refer her to a physician who does quite a bit of hormone replacement therapy, and someone who is also able to have a conversation about some of the options that are available, okay, to manage the symptoms. Because again, everyone will experience perhaps a different, you know, um, set of symptoms. No one shares the very same. So there are ways to manage the symptoms of this condition. Again, menopause is a very natural thing. When we look at mental health, though, there are different ways to do that too, right? Sometimes we have to prescribe for the depression some medication. Contrary to what we all think, bush medicine don't cure everything. I mean,
Right. It's true.
bush, I feel like everyone's, oh, I'm gonna drink BC, I'm gonna drink Cersei,
Yeah.
like, yeah, it does. Look, it has its place,
Yes.
but we must take a look at what exists. Look, Bree, I mean, like I said, I could talk about both menopause and mental health forever, right? But what we must recognize too, holding on to some traditions are cool, but it's not Vicks. Just don't cure
It's
everything.
true. It's
Doesn't work.
true.
So we have to take a look at what we need to do now. So
It's true. I'd like to welcome Andrew, and it's all up to me. Thank you so much for tuning in. I do think a part of the stress is like when we hold it in and we're just so overwhelmed by everything that is going on and not releasing it. I would like to encourage all the women who are watching tonight and the husbands, if you have not gone to see someone like Juliet for this issue, I would advise you to do it. I mean, why suffer when we don't have to? Like, I'm envious that that women can actually get this kind of help, because like I said, when I was going through this,
mhm.
women talked about it, but it wasn't in great detail. It was like a secret shame, if that
Yeah,
makes sense.
yeah,
And it's like, I remember speaking to my mom about it. She said she didn't experience it. So I was like, I just felt hopeless. So I'd like to ask you about how effective are hormone replacement therapies, HRT, for mental health symptoms, and are there any risks? Now, I remember hearing about treatments, but I heard about cancer. Once I heard that, I decided it wasn't worth the risk. I'll just have to suffer.
right, right, right. And I'm glad you brought that up because I actually made a note about HRT. I was reading an article recently about it, and what I know, Brie, is that with every treatment, right? With every treatment, there are risks and there are benefits. I'm yet to see something that you take a Tylenol. I'm not sure folks know that acetaminophen, right? The active ingredient Tylenol can cause some issues with the liver.
Okay.
That folks still take a Tylenol for headache, right? The studies in the past have talked about hormone replacement therapy or HRT as um, something. Well, there's a whole range of them, different types that are used to manage and treat, like and causes cancer and all that stuff, right? If you Google that stuff or you chat GPT that stuff, you're gonna find it, right? This information is out there. But I found something here that I want to actually read. It says how
Okay.
HRT can be effective for what we call mood stabilization, especially in early menopause. It may alleviate depressive symptoms linked to estrogen loss. However, it's not a universal solution. Risks include increased risk of blood clots, stroke, or certain cancers. So, what I do personally, I assess medical history very thoroughly because if a woman has had a history of cancers, breast cancers, right, it is, or right, other conditions where HRT or hormone replacement therapy is contraindicated. In other words, they don't qualify for that stuff. Then I will refer again to the specialty or the physicians or other medical providers who are better able to advise a woman on using that option to manage what we're dealing with here. But we know that if there is a hormonal problem that's causing a mood change, we must address it. It might not
Yes.
be HRT, but it might be another alternative. So again, it's all open up to conversation because there's no one unique approach for all persons. But yes, it can be an effective um, consideration.
What are some pharmacological strategies that women can use to support their mental health during menopause?
Well, I am a holistic mental health practitioner. And I know we're talking about all this holistic stuff, we see it out there in the media quite a bit. And I'm not sure what holistic might mean, to each individual. But there is no one way to approach managing how we feel, right? And what I tend to talk to folks about is, first of all, I like to tell folks to try to quiet their mind because there's a lot of we just don't know how to quiet our mind. Sometimes the mind is so busy that we're not even able to gather our thoughts long enough. And there are folks who are also very uncomfortable with a quiet mind.
Yes.
The benefits of mindfulness and meditation is well documented in the science. That is one of the issue that we have to work on. Finding solitude, finding a place where you can literally figure out really what's going on. You would
Yes.
be very surprised how folks show up at a doctor's office and they have no idea why they're even there. You don't even know where to start, right? You ask about this, you're like, yep, this, nope, yep. And then you go back to another question, they're like, oh, yeah, because they're just not sure. And many times we don't know how to explain things. But I've often said, just say it in your own words. Just say what's going on. Quieting the mind and making a note of really what's happening within, again, within reason, because you know yourself more than everybody else.
Yes.
Mindfulness meditation is a thing. Be quiet, write it down, journal what's happening, and in that way you can also gain some perspective because it allows you to observe yourself. When you know what you're talking about, you're able to observe yourself. That's a part of that mindfulness.
Yes.
There is such a thing too called cognitive behavioral therapy, CBT. It's where you are guided by a qualified professional who can help to guide your thoughts.
Yes.
Because sometimes our thoughts run away with us. We overdiagnose ourselves all the time, or we're scared of things that don't even exist, right?
Yes.
We restructure the thoughts because there are also areas in our thoughts that we overgeneralize everything. We catastrophize everything. Everything's big and crazy. It's either life or death. There's no in between. Regular physical activity without overexertion, because there are also folks who work themselves to a smithereen, and it is kind of, it, not the way to go. But regular physical support activity, balanced diet, foods that we eat that are not ultra processed. These are some things that we can manage, or we can manage our way through this. In other words, you cannot get to the end of this menopausal journey or the mental health, illness journey without incremental steps, right? So
Yes.
we look at movement is medicine, mindfulness, meditation, eating well, getting good sleep, refraining from harmful substances like alcohol, drinking water, staying hydrated, adequate sunshine. Those are lifestyle interventions that we can use to manage our weight. And do not do not forget the use of medications.
Yes.
Medications also help. They have their rightful place. We tend to build a scare around that stuff, but it has its place if that's needed.
Yes. I'd like to welcome Lloyd McPherson. Thank you so much for tuning in. My next question is, how do societal attitudes toward aging and menopause impact women's mental health?
Well,
I think that's a big one, because you know what, Juliet, it's easy to lose your confidence during this stage. And all of a sudden it's like, what I have noticed is that for some it's like women as they age don't matter. They choose not to see the beauty in older women. It's like, okay, you have wrinkles now, you're not this, you're not that, so you no longer matter, or you're not the in thing anymore. So I mean, what's your take on that? That's a lot on a woman. I mean, when you think
oh,
about it, that's a
yeah,
lot of pressure and a lot of stress. You're trying to remain relevant, you're trying to, you still want to feel like you're attractive.
yeah. My philosophy on this, and it's again, it's a personal thing.
Yes.
Beauty starts within. It's
Yes,
not
it
it's
does.
what I look like. Yeah, it's not what I believe you should perceive me to be. Beauty comes from within all of us, and unless
Yes.
you're sure of who we are, I spoke earlier about um, just spending time with yourself. You're your own good company too. Know who you are. I believe that when we know who we are, we do not give we can allow others to perceive who they think we are.
Yes.
um, I think we need to find our place standing on both feet. Aging is a multi-billion-dollar, this whole aging thing now, right? Most
Yeah.
folks want to either reverse the process. You can't reverse your age, but you can reverse, right? We do all kind of surgical stuff. Not against any of that stuff, but you know there's something about building confidence, and that comes over time. There's something about a confidence and wisdom that
Yes.
happens over time. And if we're going to struggle as much as we do with holding on to, the younger version of us, I'm not sure how much we're going to be learning. And
It's true. It's true.
that's my person. I
It's
learned
true.
stuff now that Maria, I never knew that stuff way back when, and I wouldn't want to go back there because I'm happy with what I know now, right?
Yes.
So, with that being said, though, yes, society has a way of kind of branding us that we should look a certain way, but self acceptance is important. And whether you're dealing with a mental health issue or you're dealing with a hormonal issue as it relates to a really very natural process in life, like a menopausal thing, it is important that we accept it, we recognize it, and know that there is support out there, right? Without
Yes.
struggling with some of the things that society tells us that we ought to be, do, look, and all that pressure, right? So, with that being said, I believe that we need to embrace our gray hair. And when you feel like you want to
I
pull it
had
off,
to learn to, it took, doing COVID is when I learned, finally
yeah,
came to that place where why are you killing yourself, coloring your hair all the time, and
Exactly.
I actually have come to like it.
Yes, I love it. Beautiful, Brie. Keep wearing your hair. It looks gorgeous. Let us just and look if there are all of some of us who feel like we want to add the color, go add your color. Why are we fighting?
Each his own.
Yes. All I ask is that we take care of our skin,
Yes,
right? Make
yes,
sure we practice
yes,
good self care because we have to hydrate. And my youngest daughter keeps saying, "Mom, you got to do skincare. Don't forget, did you do your skincare yet?" I said, "Right." So, and it's always nice to embrace those little younger ones who know how to buy those little pretty stuff,
yes,
right? But we have to get back to a place, Brie, where we really accept ourselves and take care of the things that make us healthy and well without having to conform to societal expectations. That's a very, very tough act to act to follow. It's hard.
yes.
And when you're dealing with hormonal changes and you're feeling anxious and you're feeling depressed, and when you're going through all that stuff, who needs what society tells us to do?
It's
Let's take
true.
care of ourselves. We don't need to add any more burden to our day.
No,
So,
that I definitely agree with you on that one. What
mhm.
barriers do women face when seeking help for mental health issues related to menopause?
Well, barriers again are, sometimes is an access issue. You don't know where to go. Where do you begin? And I think I mentioned that earlier that I think it is important to begin with your primary care physician
Yeah.
because, and I know how it is these days when you go to the doctor and you perhaps don't even have the time to explain, right? I'm not going to say that's the case for many. Depending on where you live, where you are in life, what's happening, that all are factors that you should consider. But I believe talking to a qualified medical professional so they can, if you were to, for example, see me, right? We will be talking again about history. What's going on? Tell me what's going on, right? I tend to order blood work, right? I order blood work to make sure that there's nothing medical going on. You come back, we look at the blood work. I do some, all that investigative work just so we can establish a baseline. But there are folks who cannot find qualified providers. I get it. There are also financial constraints. Sometimes you're still raising a family. You have your kids, you have your grandkids, right? There are all kinds of factors. Barriers to are some of the stigmas, right? There are all kinds of stigmas out there as well that we know it's real. There are also, the mistrust of the medical community. We know too, Ray, that not everyone trusts doctors because they say, well, we're
It's
trying to
true.
make some money, we're trying to sell this, we're trying to sell that. Other barriers exist on so many different levels. Could be cultural as well, where women are just expected to just go through the thing and not say a word, right? So depending on what the situation is, there are many, many barriers that exist. We just have to look at each individualized situation and see how best we can support each other too. Because sometimes you have a sister in that you can talk to, and they know somebody you don't know, right?
Yes.
So that's just how it kind of works. Talk to your spouse if you have a committed spouse, a committed relationship, and you're having some trouble, have a conversation, visit the spouse's physician if he has one. Maybe you could start there. Social groups, right? A nice little book club would be nice too. To
Yes.
talk to your friends because if there are barriers again with you accessing here, they would probably know someone you don't know. So
Yes.
find ways to connect and talk about some of these very common things that happen, whether it's a mental health issue or whether it's a menopause issue, because there is a big connection. There's a major collision and connection there, especially for women at a certain age.
Yes. I would like to say that I think it's so important to take care of your mental health. I have been seeing my therapist now for a few years. I had taken a break for a while, but about a year ago, I decided it was time to go back. I felt like I was ready for a tune up. And it's like it's the best thing I could have done for myself because it's just helped me in so many ways
Yes.
because now when I get anxious I have the tools. I know I know what I need to do. I don't overthink things like I used to. I
Mhm.
don't go into these little panic things I used to have all the time, because it's like I know what to do. I know how to think things through until my next session. But
Mhm.
it's like it was, I'll put it like this. I see it as an investment in myself.
Yes.
Fortunately, I have insurance through my job,
Mhm.
and I decided, you know what? I don't have a problem paying the copay because it's an investment in me. So
Mhm.
I would say to anyone out there, if you're, I've heard someone say, Juliet, like in our culture, it's like, it's a weakness. It's a weakness. And I think it takes strength to to see in yourself that, you know what, I need to seek some mental help
Yeah.
for my mental health, because there's no shame in it. I think the shame comes when you listen to others and you let the situation go on for too long, and then you do have that nervous breakdown, or you do get to that point where it's going to be much harder for you to come back because you let it go for too long. And I'm telling you, I'm speaking from experience. I will never be embarrassed to say I go through therapy. Yes, I see my therapist every Monday, and it is a blessing. Juliet, if I didn't have this therapist that I've been seeing for so long, I would definitely be making a call to you, because, seriously,
Yeah. Agree.
you place the value on the mental health of others. And that's why I like to do mental health topics, because I like to encourage others to go to dig deeper and to figure out what it is that you need, because a lot of us are dealing with traumas, we're dealing with things that we never dealt with, that we're still carrying. And then you add this burden of menopause and all the changes and things that are going on. There's help out there. It's like, let's join the modern age and take care of our mental health.
Yes, yes, absolutely. I endorse that. And Bree, what another point I want to bring up, because I see this quite a bit where folks are self-medicating, right? They're just using all kinds of things because they'd
Yes,
rather not, right? So like, what you'd be surprised what folks do, right? And everyone's looking for nothing against those who choose to do their edibles or
right.
whatever it is, right? But I tend to say, if you believe that what you're doing currently is sustainable without any ill effect, or it has the potential to elevate you to to wellness, by all means, you probably are making a good choice. But if you find that you are treating something that you have no idea what it is, you probably need to perhaps pause and talk to someone, to gain further insight, because
Yes,
the very thing that you think you're treating might not be the thing.
it's
Um,
true.
in my practice, there is a comprehensive mental health assessment tool that I utilize called a Mind Metrics, and I tend to send that to folks who've never seen anything like this before. It screens for over 60 different mental health conditions, and
Yeah.
contrary to what folks believe, anxiety and depression are not the only mental health condition
Yes.
that exist, because they're also anxiety and depression on a different on very continuum. In other words, it's not just here and there, it's along the way, right? And sometimes if you do not know what you're dealing with is depression,
Yes.
you do not know what you're dealing with is anxiety.
Yes.
And what we do, we self-medicate for anxiety and depression, not recognizing that's not what the issue is. Then it becomes compounded and it becomes something else, right? I see that all the time. Sometimes when I administer the screening tool, and the reports come back, and by the way, you don't have to be one of my clients to get this. It's something I can, offer to anyone who's interested, just so you can understand what's
Yes.
happening, right? And you can take the report and go see your primary care physician and discuss the results. But it is important for us to know what we're dealing with. Is
Yes.
it is it an underlying thing here, mental health wise, or is it a change of life, right? And self medicating is not an option. It's never a good option.
It's not going to help.
It's
It's not going to help. Andrew is asking, what can a husband and the children do to help in the situation?
Andrew, thanks for asking that question. I appreciate that very much. One of the things that we husbands, and I enjoy saying that because I do have a very supportive husband. It's validating. Validate when
Yes.
someone tells you. Validation is very important because there are times when you say something and like, no, that's not what's happening. Well, what do you know? I just told you this is what's happening, and you feel unheard.
Yes.
If your spouse tells you that this is how she's feeling, clearly she's your spouse because you're right. You have a relationship that is honest and open and supportive. And if someone tells you that this is what they're feeling, your wife or otherwise, you must validate it. Validate first, and second, offer self, offer. Do not tell her what she needs to do.
Yes.
Offer. Allow her to be an equal participant in decision making and offer yourself. Look, I'm here for you. So in case you decide to do so, I'm here to support you. And I can only imagine how difficult this must be for you. So validation is important, offering self. And then you continue to engage in conversation and support her, ongoing.
Yes. What advice would you give to women who feel like they're losing themselves during menopause?
You're not alone.
Yes.
You and all the women who will, get to this point in life where, um, Mother Nature is very powerful. Mother Nature knows what she needs to do at certain phases of life. Menopause is no different, right? Estrogen decreases, progesterone, and we have other hormones, right, in our bodies that just do things. Um, if you're experiencing symptoms of menopause, whatever those symptoms are, right? We talked about them as fatigue, right? Um, Not low interest or no interest in intimacy, perhaps. Fatigue, again, I did mention fatigue, some anxiety, some depression, irritability, issues with sensitivity, all those kind of
Yes.
feelings that for some reason you're just feeling that kind of way and they're transient. In other words, when we address them with whatever the therapy is, they
Yes.
kind of change. If you're dealing with those things, talk to a medical provider and get some help, get some a clinical workup is important. And these doctors know what you're going to be checking. And if there are no clinical findings, nothing remarkable, indicating that you're in menopause, it means that there could be something else going on. Continue to follow the follow the trajectory. I would say going to see a specialist like myself, who is a mental health provider, and we can take it from there. And we'll continue to look for what it is that we need to find in order to treat, and then we're here to support you. But if you're going through this stuff, you're not alone. You and many, and it's time to start talking about menopause. As I mentioned,
Definitely.
it's important.
Definitely. I'd like to welcome the bridge and Maxine. Thank you both for tuning in. If someone is interested in seeing you, Juliet, how do they get in touch with you?
Thank you, Bree. I am going to recommend that I have a telehealth practice. I see folks all over the state of Florida via telemedicine, and you can find me on my website is a newmindbodyconnect.com. So it's a new mindbodyconnect.com. You can find me there. And you go to the website, all the information is there. You can also find me here on Facebook, Juliet, right?
If a
Um,
person doesn't have insurance, but they're still interested in seeing you, can they work out some sort of plan or whatever it is with you?
Here at Anil Mind Body Connect, I am the owner and CEO of my private practice, and I have not, I have never turned anyone away because of their inability to pay. Um, I am committed to what I do. I am Bree. I'm from Jamaica. You know me, right?
I know you, girl. I know you.
And my heart is fully, fully, fully committed to make a difference in the area of mental health. I have seen where this thing has caused a lot of relationships um, to you I can so I'm here to say, look, whatever I can do to make a difference, money is not going to be the issue. I work with a lot of organizations as well, where I am committed to, again, support each person, make referrals, or whatever I have to do. But mental health is something, it means a lot to me. And whether you're here or you're listening to me in Jamaica, right, one day I hope to also have a practice in my community there in Portland, Jamaica. It is my goal, as the Lord allows. I really want to make a difference. So, yes, anyone can reach out. And if I'm unable to meet your needs, I will be happy to refer you to someone who can. But I'm here. I'm here to help make a
And
difference.
I would like to say that I don't think you have anything to lose. Reach out to Juliet. I definitely, like I said, if I wasn't seeing my therapist for years, I would definitely be calling Juliet. And as I tell you on this show, I would not recommend anyone if I didn't know this person. Juliet's the real deal. And look, I appreciate you so much, Juliet. I know you're busy and I know you have something else that you have to do tonight. So once again, thank you so much for coming back once again. And I would definitely like to have you come back in the near future when you're available.
Okay, Brie, my pleasure. It was really a pleasure being here, and I'm grateful for anyone who, chimed in tonight. And I hope that many will get to see this program again. Brie, I want to say thank you for what you do, okay?
Thank you.
I know you could have been using your time for many, many other things. It just speaks to your commitment to make information available to your wider audience. So thank you so much. Thank you, Brie.
Thank you so much for saying that, Juliet. And remember, guys, reach out. In this day and age, we don't have to suffer anymore. We don't have to suffer. Take care, everyone. God bless. And I'd like to wish everyone a great week. Take care, everyone. Once again, thank you, Juliet. God
You're welcome.
bless.
Okay.